Uh, welcome to those of us who are watching us live. I'm glad that this is finally working. Kind of basically here at Progressive Mass, we started having an interview series to address both like the short-term and long-term responses needed to the kind of ongoing pandemic, especially now that we're more than 1 month out, and the ways in which the current crisis illuminates a number of the problems that were already there already, and the things that already needed to be done and are now just in even sharper relief. I'm happy to have with me today Vatsady Sivongxay and Cohn Rivera from MIRA. Can you both, thank you both so much for joining us, and can you introduce yourselves and tell us a little bit about the work MIRA does?
Yeah, thank you. So I'll go first, highlight the census. Thank you, John and Progressive Mass, for having both Cohn and I here today. As John mentioned, we work at the Massachusetts Immigrant and Refugee Advocacy Coalition here based in Boston, but it's a statewide organization, also spans into New Hampshire. We are the statewide complete count committee chair this year for the 2020 census. And we've just been working tirelessly with our organizations across the state, both nonprofit, for-profits, and public agencies, to ensure that all of our families, especially our undercounted populations, are counted in the 2020 census. So I'll just do a quick introduction, and I'll share this moment here with Cohn, my colleague, who can expand more about what MIRA does.
Awesome. Thank you, Vatsady. Hey, everybody. As Vatsady and John said, John, thank you very much for having both of us. I'm Joel. I use the he series pronouns. I'm the senior campaign organizer at the MIRA Coalition. For those of you that don't know our organization, we've been around for about 32 years now. We are primarily an advocacy organization, so we mostly work on pushing pro-immigrant and pro-refugee legislation at the local, state, and federal level. As part of my job as the organizer, or one of the two organizers, I'm involved in advocacy at all levels of government, and I also do civic engagement work. So we typically have a year-round voter registration program where we register at least 3,000 voters, 3,000 students to vote every year. And we also run a Get Out the Vote program that specifically mobilizes immigrant voters every fall, where we also educate and mobilize thousands of voters every year. In addition to my field work, I'm also involved in census work with Vatsady, specifically working on currently the phone banking and texting efforts, which Vatsady will tell you a little bit more about later. I'll mostly be focusing on advocacy questions today. Thank you.
So yeah, when I was thinking of what would be interesting topics to discuss, the census was one that immediately came to mind, especially because the way in which a pandemic basically like throws out so many of the typical strategies used for the census. So that like there was going to be a robust field program, various strategies to bring people into locations for parties to get them to fill stuff out, or even using libraries as central locations for kind of computers for those who don't have computers at home, given that the census is online. I'm curious about like, what are some of the strategies that MIRA, as the kind of the lead of the census effort here in Massachusetts, what are some of the strategies that you've adopted to get around those obstacles?
Yeah, thank you. This is a really important question, and the responses should help organizations as they think about outreach for census and maybe from some other efforts that require reaching our most undercounted communities. Just to take a step back, the census is constitutionally mandated by our nation's papers, and it really requires that everyone, regardless of the age, immigration status, or the location where you live, that you're counted, right? So as long as you're living in the United States on April 1st, 2020, you count in the census. And so when we're thinking about a complete, fair, and accurate count, it really means getting everyone counted. So in this time of physical distancing, where we're still trying to socially connect via Facebook, other social media platforms, emails, phone. You know, we try our very best as organizers to connect with people where they're at, right? So where are people currently? They're online, just like us here. They're over the phone, you know, you can reach them over the phone. Everyone goes to the grocery stores and might need to go to the pharmacy, or you know, some folks will need assistance and will be receiving food through the distribution spaces such as mutual aid or through food banks, right? So this is where we've kind of shifted our strategy more than we had intended originally. So on social media, we try to reach out to everyone through our MA 2020 census platforms on Facebook, Twitter, and Instagram. But our big projects are, as well I mentioned earlier, phone banking, and we'll be launching a text banking. And it's really old school, right? Old school way of reaching out to people. You know, there are a few groups of people that, big buckets of folks that we try to reach. We do cold calls to people that we personally don't know, but we also do relational organizing, which is reaching out to folks that we do know, whether we know them through our organizations or through our personal lives, our parents, our friends, our family, and other family members, right? And asking them whether or not they've taken the census and really help them with their census questions. And that means if we are really serious about reaching out to immigrant populations and undercounted communities, again, we're meeting them where they're at by speaking with them in their language. So volunteers who are bilingual are really welcome, and we appreciate all their contribution. So just to highlight the success of this, of phone banking so far, I think the report that Joel sent to me earlier today said that our collective efforts in working with other organizations across the state who are trusted community voices like Neighbor to Neighbor, you know, like the New Bedford Complete Count Committee, which includes like faith organizations, working with the ACLU, working with CPA, ARW, Mass Voters Table, especially co-leading with Mass Voters Table, where we reached pretty close to 14,000 people.
Nice.
And our contact rate has been over 10%, which is like really great, right?
Yeah, for phone banking,
that really means like people are really eager to hear someone else, like to relate to someone else in this particular time. And also that when we call them and talk to them about the census, that this is an opportunity for them to contribute to their community at the in their comfort of their homes, right? Other strategies that we're doing statewide is encouraging folks to pass out through the mutual aid, through the distributions of food, Meals on Wheels, to school lunch programs, breakfast programs, flyers that share more about the census and informs folks about how they can take the census online, over the phone, or via mail now. Now we have a lot of different strategies.
Yeah,
right?
and quickly, can I just jump in? I realized I started somewhat like in Amadeus race by asking about the strategies. Quickly, or even longly, why is the census so important? Which I think is a good preface for this discussion. Why should somebody think, oh, this is a document that I need to fill out?
Yeah, it's great to take a step back, right, and better understand why the census is important. The census is important because it allocates trillions of dollars, federal funds, to our communities, right? And these funds goes towards like healthcare facilities, determining workforce development funds. It determines like the libraries and what technology programs go into the libraries, and also the school lunch programs, the breakfast programs. It also determines funding for special education. And here in Massachusetts, it does touch everyone's lives, and whether you're, taking public transit, because it goes towards that funding. And as we know, our T really needs help. And maybe this is an opportunity to funnel some of that, but our sidewalks, and also as far as planning our communities, if we know how many people are there, if we know, what type of food interests people have, we can better have planning for businesses, having our ethnic businesses there to serve our diverse population, right? But in this particular time, what we're seeing is that the funding and the decision of allocating medical resources to different states is based on part of the formula is based on the population count, right? So this is how decisions are made on allocating medical supplies in the time of crisis like this, allocating support in the National Guard to certain areas of our state, because they want to make sure that the supply matches the demand based on the population. And I'm pretty sure that when the vaccination, hopefully, a vaccination will come out, and if we get a better count in 2020, we can better provide the amount of vaccinations to our various neighborhoods and districts. In addition to that, political representation is determined on the population count. So we can see that after every census, our redistricting will show the contract or the expansion of our districts.
And out of curiosity, which populations tend to be the hardest to count?
Our most underrepresented communities, so minorities, POC, immigrants, mobile young adults, our young children, children under 5, especially our Black and Brown children, were undercounted, always been undercounted. As far as our ethnic populations, there were about 700,000 Hispanics. So I'm using Hispanics because that's the category that the Census Bureau uses. And we had about 700,000 Hispanics missed in 2010. Our native people are the most undercounted. And our young children under 5 was, we missed over close to 2 million children across the nation.
And how do you determine that rate of how many people who aren't actually being counted? Like how is that estimated?
Yeah, I am not I'm not very good with math, but so I can kind of give a general general response to that. Basically, they would compare the census data with the other data that the Census Bureau collects throughout the year. So like the American Community Survey, the other types of surveys, and then determine based on all of that how many folks were missed.
And what are some of the reasons why people end up not being counted?
A lot of times there's a mistrust of the government, right? Especially around this time. There was the administration's efforts to really instill fear in our immigrant communities by putting the citizenship question. Incarcerated folks and people of color have always had, in general, a negative experience with government, and so they just don't feel comfortable sharing their information. Right. And then there's also the struggle of the language barriers too.
And then what are some of the things that can be done to help kind of overcome those obstacles and kind of help people to understand how vital it is that they get counted, and kind of the resources that can come with that, and even the representation that can come with that?
Yeah, the best strategy really is relational organizing, peer-to-peer, having that conversation and saying like, our community have always been missed, historically been missed, and that's why we don't see that our schools have the resources that they need, right? That's why some schools don't have libraries. That's why some schools don't have the equal amount of counselors for prepping for going to higher ed or determining vocational training, right? So hitting on points that really relate to the person you're speaking with is the most effective way. And then making it more accessible for them, right? Directing them to my2020census.gov and saying like, come on, it takes less than 10 minutes to make an impact for the next 10 years, right? If you really want an easy way to make change, like this is it, right? And really, you don't have an excuse, you're at home. So relate to them and really talk about what matters to them. Because again, the census hits every part of people's lives, whether you're using public transit, affordable housing, you're a policymaker, you're a teacher, you're a person who really would benefit from workforce development, right? Or you're an elderly person who relies on our healthcare system, or a family, or you may know a family that breakfast and lunch programs are critical to their children's lives, because that might be the only meal that they may have.
And so what are the common, building off that discussion, what are some of the most common misconceptions that people have about the census?
Yeah, well, I think a lot of folks, in general, a lot of folks think that it's a really like burdensome questionnaire, and they think it'll just take a long time to do it, and that's not true, right? Some folks have posted online, it only takes 2 minutes. The other misconception is that the confidentiality of the information. The information remains confidential. The individual information remains confidential for 72 years. And John, do you know why it's 72 years?
Why?
I'll go tell. Because it's the expected lifespan.
Oh, interesting.
Right. So, to keep our individual responses confidential, the Census Bureau cannot share our responses with anyone. Right. And also the misconception has been this time around that the Census Bureau might share it. And unfortunately, that's not, fortunately, it is true that the Census Bureau will not share, right? That other organizations and other agencies often do share their information with the Census Bureau, but it's only a one-way street. So there's that confidentiality and fear that I mistrust the government. They're going to know more about me, and I don't want to take the census, right? And plus, it's taking it would take me such a long time to take it. Like, why would I do it? So those are two big ones. And Howell, do you think that I can pass this to Howell too, because he's on the ground a lot as well. And I mean, those are the two big ones that I've been seeing. But Howell, if you think that there are other points, please feel free to chime in.
Yeah, so I was sharing the Facebook Lives. John, could you restate the question, please?
Yeah, no problem. We're talking about what are the biggest misconceptions that people have about the census?
Yeah, I think the biggest, I think people think that it'll take a long time. I was just talking to someone called me back earlier today from a phone bank, and they were confused about, one thing is that people were confused about the city census versus the national census. That's a big misconception. I was on the phone with a woman for a few minutes earlier today because she couldn't find the census form in the mail, and then she found one from Boston, and I was like, that one's important too. Like, you need to fill out the Boston one because that's really important for the municipal census as well. But this one, the one I'm talking to you about, is the federal census. So I think in some of our communities, there's especially for those who are non-native English speakers, this whole conversation happened in Spanish, is that they're unclear about the difference between a local census and a national census. And then definitely, I think people are concerned about how long it's going to take, whether it will be difficult. And then obviously, we can't say this enough. I think for immigrant communities and the undocumented communities, there's an issue about security. There's a concern about security, and I think that's completely valid. And I think that's a conversation that we have to have, because those fears do exist in the community, and those are conversations that we have been having and will of course continue to have with our community members to encourage them that it is safe to fill out.
And then just to build off that, I think it's kind of important that kind of people know that like that the purpose of the census is to count everyone, regardless of their citizenship status. I know because I was talking with a friend whose husband has a green card, and he and then some of his friends didn't think that they needed to fill this out because like, oh no, that's just for people who are like formal U.S. citizens. But like when it comes to say resource allocation and like city planning, et cetera, like, no, that's every human being living there, not just every citizen.
That's right. Yeah, and that is a misconception among our foreign population, right? And especially with students, students, and even grad students or folks who just graduated and they're on like their first visa, right? Like they think, oh, because I went to school here and I'm planning on staying here for the rest of my life, I don't need to fill it out. And it's like, no, you should fill it out. You live and sleep here most of the time here in the United States, and it doesn't matter, you know, how you got here or what location you're living. But you know, what really matters is that you count where you've been living most of the time in the United States.
And thinking of students, that's one thing that I've been thinking about is what the impact of the kind of current pandemic is on the counting of students. Because like I know I live near a number of colleges, I work near a number of colleges, and many of those students were sent back home. And like they were sent back home at about the same point that the Census Bureau was sending them mailers about filling out the census.
Yeah.
So what's being done to make sure that like suddenly it doesn't end up looking like Fenway and Alston have a lot, and like in Mission Hill have a lot fewer people than they do, or suddenly like Cambridge and Somerville's populations shrink, or the same out like in various like college towns in central and western Mass.
Yeah, so what's really great about census here in Massachusetts is that there's so many partnerships happening across the state and within cities. At the statewide complete count committee level, we, Secretary of Commonwealth's team, thanks to John, Yuri, and Bill for their hard work, they sent out an email to all of the universities and colleges to remind them to send out the message to the students that they count, right? Like if you're living on campus, then you're going to go through an administrative count and the school will count you. If you're living off campus, then that means you count where you would be living if you were going to school. And then for students who are coming home from study abroad, they count where they're at on April 1st. In addition to that, we've at the Mass Counts level, and the Mass Counts is a coalition of nonprofits. It's also part of the statewide complete count committee. They sent out emails with examples of slides so that professors can put it in to their virtual lessons.
Nice.
And then here at MIRA, we have Iman, who's been again working with our census team at MIRA, and they are rolling out some PSAs that they created with a bunch of tough students, and it's going to be really great when it comes out. I just actually watched it right before I hopped on. But they also created a Facebook group where the different schools, student groups across the state are joining, and they're spreading the message that way as well. So working at the state level with all of the administrations, working with the faculty, and then also working with the student groups. So those are the strategies. And we're all saying the same message, which I had shared earlier about off campus, on campus, or study abroad.
And then in terms of like populations that might be especially hard to count now, what's being done to make sure that that those experiencing homelessness can still get counted properly? Because it's like it might be difficult to mail them kind of the census form itself.
Yeah, so individuals who are experiencing homelessness and housing instability, there's a separate count. It is the service-based enumeration is a count, a unique count of itself. So just to give a basics about that, service-based enumeration happens over 3 days. Originally, it was supposed to happen the last 2 days of March and in the first day of April, and that has been suspended. Well, there's no new date scheduled yet because of the coronavirus, but when it is rescheduled, what will happen is the Census Bureau will work with the service-based organizations to do the count at their organization. And then the Census Bureau will work with the city to go on one of the days to count the homeless population at a place where they usually stay. So that could be at the park, near, the church, underneath the bridge, and that is just a simple head count.
Mm-hmm.
So unfortunately, that is one of the most difficult population to count, and right now it's on hold.
Yeah. And thinking of when it comes to, say, dates and deadlines, what is the deadline for the census?
Well, the tentative new deadline as of April 13th is October 31st. Originally was the end of July. So the enumeration efforts it will end October 31st. The field operations, which includes the hiring and recruiting of Census Bureau workers that have not yet been hired, and knocking on the doors, all of that training is currently scheduled to happen now June 1st. Service-based enumeration and the mobile questionnaire assistance, which is an effort to go out into the community, the Census Bureau's efforts to go out into the community and help folks fill out the census. Those are suspended without any firm dates as of right now. So those will be based on the coronavirus situation.
And then thinking in terms of like how we make sure that everybody gets counted. If somebody's watching this now or later, or should be watching this now or later, how can they help? Like, how can somebody who's like now staying at home more than they probably thought because all the events that they had planned to do are all canceled now, and they have this free time and want to be civically engaged?
Yeah.
What can they do to help?
Yeah, for anyone, you can reach out to MIRA, and Joel and I can direct you to the phone banking and text banking. Again, we have so many households that we need to reach out to. Right now, we just passed the 50% mark of the population count as of today, but we have so much more to go, right? And right now, the rates per day of increase is less than 0.5%. So we really need folks to come out and help. If you're at an organization and you can hold your own phone banking or text banking, we can train you on that. And we're working really closely with the Mass Voters Table to provide the training and the phone banking. Currently, the phone banking with MIRA and Mass Voters Table, those sessions are on Tuesday and Thursdays. However, we're working with partners across the state, and we can plug you into their phone banks as well. For organizations that are like serving individuals directly, I really ask that you put a poster up. If you're serving food or delivering supplies, to print out our half-page handout with the my 2020 census.gov website and all the language hotlines, and put that into the package that you're delivering. Those would really help tremendously. And for folks who can elevate over social media, over the radio, your local TV, and if you have channels to those type of outlets, please reach out, and we are happy to give you a script for a PSA.
Awesome. And then just quickly, do you happen to know which cities have the highest rates? You were talking about this Massachusetts as a whole. Which city has had the highest rate and which one the lowest rate?
Yeah, so let me just look it up. Yesterday, Norwood had the highest rate.
Oh, interesting.
Right. And is it Goslon? I believe in Barnstable County has the lowest rate.
Oh, interesting.
But
Is the Cape typically a hard to count place because of the kind of like the distance there, as well as the economy that relies on a lot of, like, say, both I think people who have like their second homes there a lot, as well as like a service probably a somewhat heavily immigrant service population there
Mhm,
as well.
mhm. So typically, like historically, the Barnstable County is not an undercounted community,
Hmm.
but it was projected to be an undercounted community because of the transition to internet
Oh, interesting.
and the different and the shifts in field operations for this particular 2020, especially with the update leave,
Mm.
delivering like the households that have PO boxes or have limited access to internet would get a paper package delivered. So that's called update leave. But historically, our gateway cities are the ones that have been the most undercounted. And for
Like, remember,
example,
Lawrence tends to be very heavily undercounted.
right, Chelsea, Lawrence, Lowell, Boston, right? So there are about 80% of 80% of their population are considered hard to count.
Wow.
So I think if we really believe if the update leave operations, you know, resume, then we'll see a higher percentage of responses in like Barnstable and like Martha's Vineyard and Nantucket. And I'm just going to correct what I said earlier. So Gosnod is actually based in Dukes County, which is Martha's Vineyard, and that's
Okay.
they have most of Martha's Vineyard is receiving update leave update leave. But to your question, are the cities and towns that are historically undercounted are our gateway cities, and also in Western Mass, there's Worcester and Springfield.
Makes sense.
Mm-hmm.
And then one thing that we also wanted to make sure that we talked about in this discussion today was about how the current kind of pandemic and the economic fallout is hitting the immigrant community in Massachusetts specifically, and especially about how we what has MIRA been doing? Like, what have you been hearing on the ground, and what are some of the things that you've been advocating for to make sure that in any of the responses that come out of this, that those responses make sure to include the immigrant community as well and don't leave them behind?
Mm-hmm. Yeah, so Hawal has, I can respond, but this is Hawal's space right here.
Yeah, for sure. So as we have alluded to, I think at least a couple of times today, we are making phone calls. So that's something that I know a lot of folks who are at home are looking for things to do, so they can go into the MIRA Eventbrite page. That's also shared on the MA 2020 Census Facebook page and the MIRA Facebook page. So what we're doing is we're making phone calls to folks in what the census calls hard to count census tracts, so areas of the state that are projected to respond at a lower rate to the census, right, for self-response. So currently we're calling a bunch of neighborhoods in Boston. We're calling Eastie, Roxbury, Dorchester, and we're just going to add to that. So we're adding some districts out in Western Mass, in the Amherst area. We just added some areas down in New Bedford as well. So we are certainly trying to reach the hardest to count places. So that's a really great way to use your time. We're doing that Tuesdays 11 to 1 and Thursdays 5 to 7. So MIRA and the Massachusetts Voter Table are co-leading those trainings. And so far they've been really great, as Vatsady said. Our efforts have generated over 2,000 calls and almost 300 contacts. That's like a 14% contact rate, which is awesome. And then we're part of a larger statewide effort of organizations that do civic engagement and census work that has generated over 14,000 calls and over 1,000 contacts. So that's a little closer to 10 or 11%. So the calls are working. People are picking up. People are filling out the census on the phone. Even if we get a disconnected number or a wrong number, those people are still happy to hear from us, and we're encouraging those people to fill out the census form as well. So it's a great opportunity for folks to get involved. It's easy. There's a short training, and then you start dialing right away. And folks can also do that outside of the hours. They just need to coordinate with us. And if folks are part of organizations, either formal or informal, like activist afternoons, they can adopt a phone bank as well and make calls collectively. So there's a bunch of different ways for folks to plug in, but helping us make calls is a huge thing that we can do now, especially since we can't go to people anymore physically. We have to go to them through the phone.
Yeah. And some of our immigrant organizations that we work with, especially in the MIRA coalition, have plugged in census as they're doing wellness calls, right? Well, and then taking a survey and an understanding of like, what are the needs on the ground? What do we need to advocate for to help our immigrant communities? And then, well, do you want to share a little bit about some of the advocacy initiatives that we've done outside of census?
Yeah, absolutely. So we're involved in a number of things, and I'm, tangentially involved in a lot of them. I'm not a lawyer, unlike Vatsady, who is actually a lawyer. But we have a couple lawyers on staff. We have a state policy director, Amy Grunder, and a federal policy director, Jessica Kiko, who are both wonderful. So any proper legal questions we can forward to them. But from an organizer's perspective,
don't worry, I'm not drilling you on the ins and outs.
Yeah. So from an organizer's perspective, we've been involved in advocacy at both the federal and state level on COVID-19 related relief efforts. And I can, John, if you have any specific questions, I can talk to.
Yeah, we'd both be curious about kind of what are some of the things that MIRA has been advocating for, as well as what are some of the things that MIRA and its partner organizations are hearing on the ground about how the crisis is hitting the immigrant community in Massachusetts.
Absolutely. So thankfully, we have a fairly good, I think relatively speaking, federal delegation. Both of our senators are fairly progressive, and most of our representatives are as well. So we're part of some national coalitions, including FIRM, the Fair Immigration Reform Movement, and the National Partnership for New Americans, NPNA, that we're involved with at high levels. So we were involved in advocacy at a federal level to include immigrants and undocumented immigrants in the CARES Act, for example, for that relief package. Unfortunately, that's not how things went down, and our communities are the ones that are feeling that on the ground, but those were certainly efforts that we were a part of in pushing. There's currently a bill that was proposed very recently that would seek to address that lack of caring for our undocumented brothers and sisters who were not covered by the CARES Act. So that's something that is currently in Congress, and something that we can certainly support in terms of. And so then at the state level, there's a number of things happening as well. It's interesting because we've seen, ever since early 2017, we've seen a shift in the way that we do our work and pushing for a lot more for state solutions, Band-Aid solutions to a federal problem, immigration, right? So it's why we're pushing for safe communities. Because
and tell people who may not be familiar with the Safe Communities Act is, what is the Safe Communities Act and why is it so important?
Yeah, absolutely. So the Safe Communities Act is a bill in the State House. It's the second session it's been filed, and the goal is to limit local police from collaborating with ICE. That's at the crux of the matter. There are a number of ways, they're all voluntary, that local police can collaborate with ICE in internal immigration enforcement. And what the Safe Communities Act seeks to do is to end all of those ways. So we would be banning these 287G agreements, which are the most extreme form of collaboration with ICE, where we deputize local agents to act as ICE agents, and we don't get reimbursed for that. So that's our taxpayers paying for the separation of our families. It would also include a due process provision that make sure that folks who are in ICE detention are read their rights, because immigration law is civil and not criminal. So you don't get Mirandized when you get picked up by ICE or transferred into ICE custody. So we want to make sure folks know their rights and know they have the right to decline an interview with ICE, and a right to an attorney at their own expense. Those are a couple of the big provisions. I could talk more about safe communities.
Yeah, and one thing, and just wanted to quickly highlight, and feel free to either of you to expand upon this. One thing that I've been thinking about recently is that even as the legislature just shelves all of the policy discussions before, the current moment shows why something like the Safe Communities Act is so important. Because I remember at the beginning of 2017 hearing about immigrants in Boston who are afraid to go to some of the community health centers, out of fear that like ICE either maybe or was kind of trolling around there. And more than ever, we need people to be able to feel comfortable and able to go seek medical care if they are in fact sick during a pandemic. And the same thing, as people are being asked to stay at home, that ends up creating a higher risk for domestic violence incidents.
Mm-hmm.
And if people are in such a situation, need to feel comfortable being able to reach out to law enforcement and not be afraid that if they reach out to law enforcement, they'd be at risk of deportation.
Absolutely. And I think, just as you said, the Safe Communities Act has always been about public safety and public health, mm-hmm. right? People need to feel safe contacting emergency care workers, the police, healthcare workers, to seek the care that they need as sick people, and also as victims and witnesses of crimes.
Mm-hmm. And then, so go back to what you were saying. Tell us a little bit more about some of the other other advocacy that MIRA is doing at the state level.
Yeah. So in general, we've also been we've been very involved in Safe Communities Act, and also very involved in the driver's license bill. So the Work and Family Mobility Act and the Driving Families Forward coalition that is pushing that is something that we've been involved with 32BJ and the Brazilian Worker Center and a number of other wonderful organizations. That's also a bill that is still being pushed for during this time. We know that.
Tell us a little bit about the bill.
Yeah, so currently in Massachusetts, we have a two-tiered license system. There is the Real ID compliant licenses, where you need to prove lawful status. And then there's the standard, and so those can be used to enter for federal purposes, so flying domestically and entering federal buildings. The other one is the standard license, which also currently has a lawful status requirement, but does not need one. So there are 15 states in the country, plus DC and Puerto Rico, that issue licenses to undocumented drivers. They are all Real ID compliant states. They all have a two-tiered license system. So what the goal of the driver's license bill is just to open up that standard license to all qualified drivers. So we can make sure that all drivers in Massachusetts are trained, licensed, and insured.
And I would say that's probably something, again, especially important now as public transit is increasingly not an option for people. Yeah. I remember seeing recently that MBTA ridership fell 90%. Yeah. And many people who are undocumented are probably the same ones doing some of the ones who are essential workers right now, that are kind of keeping the bare bones of the economy that's still running, and not nearly often getting the respect and the kind of compensation that they deserve. Absolutely.
Yeah, and I think the idea of who are considered essential workers is definitely being highlighted right now. As you said, I mean, folks who work in the service industry, who work in the food industry are still, necessary, right? They're still being asked to come into work, to go to Market Basket, to work at the local Indian restaurant that we love to eat at. And so we're, in addition to healthcare workers, which are definitely on the front lines and definitely need to be celebrated and compensated, I think that all these workers who can't even get $15 on their check also need that same level of respect. And I hope that if and when we're able to get through this pandemic and return to some level of normalcy, that those low wage workers are still respected in a meaningful way and compensated as such.
And then thinking about kind of the current pandemic, what are some things that Massachusetts could do to make sure that when it comes to ensure that kind of like equal healthcare access to the immigrant community, especially the undocumented community here, especially as testing ramps up, if it continues to ramp up, hopefully, et cetera, to make sure that equal access exists.
Yeah. So as you said, I think the one of the biggest things is that we need to make sure that all immigrants, or that all people, including immigrants, including undocumented immigrants, have access to free testing for COVID-19, free rapid testing. I think that's huge, and that's something that our communities need to see. There are also other things being pushed, because we know that and a wonderful organizer, Elena Ladonna from Neighbor to Neighbor, always jokes that like, it's not like this arm is the immigrant and this arm is the worker, and then that this leg is the tenant, right? Our people are everything. They're immigrants, they're workers, they're English language learners, they're tenants, etc. So something a lot of people are struggling with, losing jobs and losing income, is being able to pay rent, and they're struggling with evictions and foreclosures on homes. And so something that, you know, some of the COVID-19 related legislation that we've been watching and attempting to support are things like the eviction and foreclosure moratorium bill. So a strong version of that passed by both the House and Senate, which is awesome, and is currently in a conference committee. So hopefully that will be on the governor's desk as soon as this week, and provide some relief to both tenants and homeowners.
And any other bills that MIRA is watching, kind of as the state like almost exclusively considers legislation in response?
Yeah, it's funny because we've been talking about how advocacy is changing right now, and so the Safe Communities and the Driver's License Coalitions, I'll use as examples as two big statewide bills that we're working on and campaigns that we're working on. They both still want to push their bills, but we're also as members of those coalitions and as MIRA as an organization, knowledgeable that we're cognizant of the fact that at the State House, all they can think about is COVID-19 related legislation, right? And so something else that we've seen that we want to highlight is that there are new PEBT cards for all children enrolled in free, reduced / universal school lunch programs. So those should be coming in the mail. We know that a lot of low-income families and immigrant POC families rely on free and reduced lunch through our public schools, and so we want folks to know that children will still be eligible for those regardless of status. So that's huge, and that's something that we're watching as well. So I think that we have, and I think that I sort of didn't answer a question you asked earlier about what we're seeing on the ground.
Yeah.
And so the times are crazy. We are doing our best to listen to and adapt and respond to the needs that we're hearing on the ground. So one of the ways that we've done that is we used to have monthly member calls every Wednesday. And so we had one, and we had like record number of people get on, and folks were very appreciative of our updates on pending CARES legislation and pending legislation at the State House and things like that. And they wanted us to have these every week. So now we have these every week on Wednesdays for our members. And we're getting, again, really great turnout on those, at least 30 people on the calls, which is awesome because folks want to hear from us. So, we're hearing what everybody else is hearing, that people are losing their jobs. They're unable to pay rent. They're unable to apply for the undocumented folks are unable to apply for a lot of the assistance that they've ever been eligible for. And for those that are eligible for those things, they're certainly applying for SNAP, WIC, unemployment. As you know, unemployment nationally is up like a crazy amount. And it took a pandemic for the state of Massachusetts to even translate their website into Spanish.
Yeah.
Right? Which is crazy that it took this international issue to be happening for us to even offer it in the second most widely spoken language in the state.
And have they expanded it to other languages yet as well, or just baby steps?
I think it's just baby steps. So there is, they're offering, the 211 line is available in 150 languages, I believe. And they just recently, I think, on Friday, I saw announced that they are now doing COVID-19 text alerts in Spanish. So you can text COVID MAESP to 888-777 and get those Spanish alerts. And so to your point, no, I don't think that they've expanded what they've expanded. So the unemployment website and the text messages to any languages beyond Spanish, even though we have so many different languages spoken, not only in Boston, but statewide, you know, including Portuguese, Haitian Creole, etc.
But our organization, especially in the MIRA Coalition, have stepped up to provide some translations of the documents, right? Whether it's for the individual family level type of benefits to small businesses, right? Because our immigrant communities and are small business owners too, and we want to make sure that they get the right information in a timely fashion so that they can also can also receive the benefits that everyone else is receiving. Like accessibility to all of these opportunities to help communities and families sustain and thrive is really important. And so as a coalition, and in these weekly calls, we try our best to coordinate these efforts, especially with the language barriers. But on the ground, I mean, we've seen a lot of organizations step up, you know, the Brazilian Worker Centers, Jobs for Justice with the Mass Docu Fund. You know, there's the Chinese Progressive Association and the Chinatown Association stepping up to help the greater Boston area Asians with food and other supplies. You know, so and then also a lot of different POC organizations are stepping up in whatever capacity they can. But I think this is just, you know, a difficult time for so many of our underrepresented communities, POC and immigrants, that it does require this level of partnership to get the information to our folks so that they can take part in the programs that are available to everyone, and that they can share, you know, the experiences that they're going through so that the community can build and build all of these programs and include and make sure that they're included. So a lot of surveys have gone out. We've done a lot of surveys to our organizations at the MIRA Coalition, also statewide at the census side, to better understand, you know, our organizations that are serving our immigrant populations, what are the challenges that they're facing, and then as MIRA and along with our partners, being able to provide the resources and the training that they need in order to serve our underrepresented communities. So at a coalition level, that's where we are the most helpful, right? Because we help member organization distribute the information to the people that really, really need it, and working with them in collaboration is key, because they're the ones that reach, you know, that serve our immigrant and POC communities directly.
Yeah, excellent. And then one thing that came to mind as well, that I know that MIRA has advocated in the past for a bill to allow people who are kind of licensed doctors in other countries to more easily work here in the US and in Massachusetts, which especially when kind of in the state of a pandemic, when you would want as many trained medical professionals as possible to work, to be able to do so. Can you tell us a little bit about that, like anything else about that bill and kind of the kind of why that's important?
Yeah, before Howell dives into that, I mean, we just want to also give kudos to Ava, who've really pushed hard on this, right? And really like motivated the staff to maintain focus on this particular matter, and also to push organizations at both the state level and the national level, and sometimes international level, because, you know, when you're working with other international states, other countries, it requires that type of agreement for foreign workers to come and contribute to our communities. Go ahead, Joel. Want to give a shout out to Ava.
Oh, thank you. Yes, absolutely. Ava's great and does a lot of national work which is
And
awesome. And is
for people watching, who's Ava?
yes.
What? You don't know
I know
Ava?
who Ava is, but for people who are watching.
Right. We're so caught up in our own worlds. Ava Malona is the executive director of MIRA. She's been at MIRA for many years and has been our executive director for most of those. She does a lot of our work, obviously a lot of our high-level fundraising and advocacy work, including advocacy at the national level, and as integration is something that is always pushed for. So this foreign trained medical professionals bill is something that we have pushed at a national level and a state level for many years. We were able to include that as a rider in the budget last session to create a commission to explore the barriers to foreign trained medical professionals. But what we're seeing now is also an opportunity to call for temporary licenses for immigrant and refugee healthcare professionals. So on April 2nd, House and Senate legislators sent a sign-on letter to the governor asking him to establish a process to grant temporary medical licenses to healthcare personnel who are licensed and in good standing in other countries. So that's awesome. That was initiated by Rep. Mindy Dahm and Senator Joe Comerford, who are great. And so that's something that we are pushing for and hoping to pass as soon as possible with the governor's help. And just like for reference, regionally, I mean, we always love to sort of play on Massachusetts exceptionalism, right? You know, the governors of New Jersey and New York have both issued temporary licenses for foreign trained medical professionals in their states. So those are two states that are close by that we like to sort of model ourselves as sort of progressive states, certainly on a number of progressive measures, legislative measures. So that's where that is, and that's something that we're certainly hoping to push for, through our connections, because we think that would be hugely beneficial right now.
Nice. And so this will be probably my last main question before we wrap up. But Joel, you talked before about like the voter registration work that MIRA does and kind of that civic engagement. What are you thinking about how what that work will look like now when in-person voter registration becomes more difficult, and that like in that door-to-door canvassing becomes more difficult? Just curious what MIRA is planning.
Yeah, thank you. Those are ongoing conversations. We're currently in the process of planning our civic engagement program for the fall, right? Where we're planning on doing a big canvassing and phone banking campaign, and are now sort of preparing for the worst. And so we're shifting that program to a lot less doors and a lot more phones. So we're using the census as an opportunity to not only reach folks, to get folks to be counted, and to use that as empowerment for community-based organizations and for community members, but also to pilot what civic engagement looks like going forward in the summer and in the fall, just preparing for worst case scenario. So I think that we are going to be shifting our advocacy and our civic engagement work to a lot more digital work and virtual work, in the same way that we've had to do for census. So instead of door-to-door canvassing where we're seeing people in the flesh, we're going to be doing a lot more phone banking and text banking, as Vatsady was saying, during the election cycle, to contact people, and are going to be hoping people pick up, because as you know, as someone who knocks on a ton of doors and does a lot of civic engagement work, the best way to contact people is that face-to-face touch, right? You have a higher contact rate. It's more work, obviously physically, it's more labor intensive, but you have a lot better chance of connecting with someone than calling them on a landline. So that's why we're also trying to collect cell phones so that we can text people and make as many phone calls as possible and do so as efficiently as possible. So we're able to contact more people, but need to contact a lot more people to actually connect with more folks. So I'm certainly going to be doing that, and I think we'll also be hoping that more and more folks are following us digitally, both by email bulletins, liking our pages on social media, following us on social media, and also going to our website, so that we can share information in regards to civic engagement there as well, in multiple languages.
And if people did want to follow you on Facebook or on Twitter or visit your website, where should they go? Yeah,
so on Facebook, we're Facebook/MIRA Coalition. Also, the MA 2020 census page is something that you should follow. On Twitter, we're also on Twitter and Instagram. So I think Twitter, we're the MIRA Coalition, and also on Instagram. We definitely need to get our Instagram followers up. So please, and we're also the census page is on both Twitter and Instagram as well. So MIRA and the 2020 census page are both on all three platforms. So please like and follow us on all those platforms. We share information daily, usually multiple times a day on all of those. We have a number of really cool like action weeks coming up for where we're focusing on specific hard to count populations, for example, for the census, and just in general for MIRA as an organization. Facebook is probably the most reliable and up-to-date source of information coming from us besides our bulletin. So if you only do one thing like MIRA on Facebook, but I hope that you'll like and follow both pages on all three platforms, because there's a lot of really good information there and good ways to get involved.
Awesome. And the website again is?
The website is miracoalition.org. We actually have a fancy new website that our communications director, Marion, put like so much work into. So please, please, please go to it. It looks like night and day compared to our old website. On the landing page, you'll see our COVID-19 resources page. You can click on that. It's also miracoalition.org/COVID-19. So we have a lot of really good information on that. And it's also language accessible and access to both state and federal resources. But we also have a lot of other things on there, resources, legal services, a bunch of different things. So we have a ton of information on our website. Please go poke around. A lot of work has gone into creating that thing and making it accessible to the masses.
Awesome. And so as we wrap up, since we're hitting kind of an hour about now, what are some of the final takeaways that you would want somebody who's watching, watching to hear? Like, what are the kind of the next steps you'd want them to take, or things that you'd want to make sure that they leave this knowing?
Yeah, definitely. Yeah, for the census, I mean, it's really important for you to take the census at my2020census.gov, and then also be part of the Census Week of Action, or the mass challenge that's coming up. On Thursday, we're having a mass challenge, census challenge. There'll be hashtag census challenge at MA 2020 census. If you can post why the census is important to you and tag a few of your friends to share the message, that would be great. And then the third thing is reach out to us, right? If you're in our organization that would like training on phone banking, or to be plugged into our phone banking and our text banking that's coming up, we would really love to have you. These are all three things that you can do from the comfort of your home. And honestly, the census takes less than 10 minutes to make an impact for the next 10 years in our lives and our communities.
Awesome. And then Joel, final messages to those watching.
Yeah. So final message, things are changing like daily. There are bills that haven't even been filed yet that we may be supporting. I really encourage everybody to sign up for our email bulletin, and also like our pages, both the MIRA and census pages on Facebook, and then follow them on Twitter and Instagram. I want to highlight, this was recently confirmed, but our Legislative Advocacy Day, Immigrant Day at the State House, will be happening on Thursday, May 7th. It was up in the air because of this COVID-19 stuff, but we think it's a wonderful opportunity to bring people together and to do some virtual advocacy for COVID-19 related legislation, and then also what was pre-March 15th MIRA legislative and budget priorities, like safe communities, like driver's licenses, and advocating for funding in that impacts immigrant communities like ABE and ESOL, et cetera. So please, everybody, mark your calendars for Thursday, May 7th. It's going to be a very big day. We're going to have a lot of really cool things happening there, and going to be relying on the wisdom of some people who have gone through it recently, like UMass Action and Jane Doe, and also trying to build upon them and include a lot more, if we can, digital and advocacy and things on Twitter, things like that. So please be in the know on those things to the best of your abilities. And as soon as any legislative or lobbying asks to anybody in our state or federal delegation will come through all of those mediums. So please stay in the loop.
Awesome. Well, again, Vatsady and Joel, thank you so much for joining this evening, and thank you for all of the amazing work that MIRA does. And thank you to everybody who watched now or will watch this later.
Thank you, John. Thanks, Progressive Mass. It was fun.
Thank you, John. Appreciate you.
Okay.